podcast is now starting. All attendees are in listen-only mode.
Hello, and thank you so much for joining us for today's presentation on growing your pediatric practice presented by BARQAR Marketing. I want to thank everybody for attending today's event. My name is Brad Smith. I'm the CEO of BARQAR Marketing, and I'm joined by Lauren Witchen, one of our leading marketing advisors here. Lauren, thanks so much for joining us.
Hi, Brad. Yeah, thanks so much for having me. It's super great to be here. Really excited for this one.
So today we're going to talk all about growing your marketing practice. But before we jump in, I just wanted to provide a little bit of background about BARQAR Marketing. I'll make sure that it's quick. But BARQAR Marketing is a full-service marketing agency. We serve several different industries, one of which being healthcare practices. And we're really focused around helping healthcare practices embrace the digital age. So looking at things like website development, social media marketing, search engine optimization, and showing up in Google search results, how to better leverage social media, and how to really use content as a way to build your practice, build loyalty, and attract new patients. And that's what the focus of today's webinar is really about. So let's jump in. And I have a question that I'd like you all just to think about in your heads right now. How do new patients and families find your practice? And oftentimes when I ask our new clients this, they don't have a solid answer. A lot of people feel like from their gut, well, it's probably word of mouth, or they were referred to us by another practitioner, or they're referred to us by someone in the network. But we don't do a great job in the healthcare industry of really tracking where new patients and families find your practice. So what I did is did some digging, and I want to look into data. Being a digital marketer, I am a huge proponent of using data and information to make better choices about marketing, just like you would with pediatric practice and looking at research and journals and studies to make better educated healthcare decisions. People do the same thing when they're looking and researching on what practice they want to look at. So there's studies out there that show 72% of people are considering whether or not your practice is covered by their health care plan, their health insurance. Makes sense, right? If we're looking for a new doctor, we want to make sure that they're in network, they fall and are covered under our health insurance plan. We want to limit our out-of-pocket costs as the patient. 69% of people reported that they're looking at office location. Again, this is kind of common sense. We want to, we don't want to drive hours to go to the doctor. We want to try to find the best option for us that's located near where we live or maybe where we work. So office location is very important. And I bring this up because it's important to think about all of these different elements and all of the rationale that goes into choosing a doctor when we're thinking about how we can build and grow and market our practice. So again, office location is a biggie. 47% are looking at how long it takes to get an appointment. What's your backlog look like right now? Is there any way that we can streamline that? Is there any way we can open up opportunity for new patients so that they're not turned off when they call the office and say that you're not accepting new patients for another several weeks? Also, we want to look at how easy it is to schedule an appointment with you. Are people using your patient portal? Is it simple and easy to use your patient portal? Is being a patient of yours a simple interaction? Or do they have to jump through hoops to get an appointment? Do they have to leave a message and wait for a callback and hopefully get a callback? All of these things go into why people choose a practice to begin with, and more importantly, why people stay with a practice and have loyalty. Almost 43% are going to look at your office hours. So do you provide convenient office hours? Are you open when they're available? Are there after work hours? Are there weekend hours? People have busy lives. Parents especially are working. They're trying to raise their children. They're trying to manage their families. They're trying to work around sports and all of the other commitments that are available. Do you have convenient office hours that adapt to their schedule, that create a sense of welcome and availability? These are all very important things. Now, I want to ask you, are you surprised by any of these? And I'll tell you, when I was reading through these statistics, I really weren't. I really wasn't. It it's just common sense. Like, all of these things are almost table stakes now. You have to have convenient office hours. Of course, people are going to look locally. Of course, they're going to look for someone who is covered under their insurance plan. These all seem like common sense items to me. But what wasn't listed in the data was this one here, trust. When you think about whether you would trust your doctor, it plays big into choosing the right provider. You need to build trust. You need to earn that patient trust. You need to make them feel welcome from the start. You need to make sure that they feel like they're in good hands if they're going to trust your medical advice for their loved ones, for their family, for their children. Trust is of utmost importance here. So I did a little bit more digging, and there's a lot of amazing research on consumer trends and how people choose to work with one company or one practice over another. And HubSpot did this extensive research around the world, and they asked, what sources of information do you trust most when you're looking to discover a new product, a new company, or a new doctor? And I want to focus in at the top of the list here. Friends and family. People trust their friends and family the most. If they're looking for a new product, if they're looking for a new company, if they're looking for a new doctor, they're going to ask. They're going to reach out and ask their friends and their family. They're going to ask the people that are closest to them who they trust. Then number 2 on the list is Google. Imagine that. Google is right behind friends and family. Now, word of mouth, that number one reason, that number one driver of who people consider, that's what's going to create initial interest. Okay, if you can increase your word of mouth, if you can increase referrals, that's going to create initial interest for your practice. Now, Lauren, I'm going to put you on the spot here. If you were asking for a recommendation for a restaurant, maybe you're asking for book recommendations, or maybe you're asking for things to do, or maybe you're looking for a new physician, and somebody gives you a recommendation, what's the first thing that you're going to do?
I'm going straight to the internet. I'm thinking the first thing I would do is look it up on Google.
Yeah, I would do the exact same thing. So it's interesting that those two were top of the list, right? The first thing we're going to do is ask friends and family. We're going to get and solicit that feedback. We're going to solicit that advice, and then, just like the majority of consumers in the U.S., we're going to go right to your website before we make a decision. And the data shows that 70 to 80% of consumers do or work through the exact same process that Lauren and I would, and probably everyone listening here too, is you're going to get that recommendation and then you're going to do some digging yourself. So when you're thinking about word of mouth, and when I asked you that question at the beginning of today's webinar about where new patients come from, and you're thinking in the back of your head, well, we get a lot of referrals. There's a lot of word of mouth. Okay, that's just the first step. Okay, that's not going to bring you new patients. That's not going to get them in the door and make loyal patients. That's going to get them to even consider your practice. Okay, they're going to consider your practice, and then they're going to go over to your website. They're going to do their due diligence. They're going to do their research, just like 70 to 80% of the US population. What's interesting, however, is this stat. And I think this is a biggie. 42% of people have reported that they'll leave a company or a business or a practice's website because of poor functionality. Think about that. Think about all that you do to drive new patients, to drive new families in your door. What would happen if they opened up your door and they saw your waiting room was packed or disgusting or not clean, and they simply walked out the door? What would you do? You'd probably fix that issue really quick. Well, think about how many people are visiting your website. you're not going to have the luxury of seeing them walk out your door. You're probably not even going to know that they're leaving because you didn't know that they were there to begin with. One takeaway from this call is I want you to put on your patient hat. I want you to go through your practice's website and I want you to see if it has good functionality. And we're going to get into this here in a few slides and talk about what that good functionality looks like, because we could have the best marketing in the world, but if we get them to a place where we're not building and earning that trust, they're going to leave without taking action. So let's get into that right now. And in today's webinar, we're going to have 5 tips on practice growth. And the first one here is to create a better website. So what really goes into a great pediatric practice website? The first 2 items on this list here are simple navigation and making sure that it's easy for people to find the information they want. We want an about section, and we want to learn more about the physicians, the practitioners, and the office staff. These are all extremely important. This helps build trust. Before somebody is going to walk in the door, they're going to do, again, their due diligence. They're going to look at your physicians. They're going to look at your office staff. They want to feel comfortable. Let's make them feel comfortable. Let's include great pictures of your practitioners. Let's outline some background about them. Let's, again, make them feel comfortable. Let's share more information than just where they went to medical school. Let's make people feel comfortable. Next, we want to make sure that your contact information is prevalent and easy to find. This is one of the biggest turnoffs. If somebody comes to your website and they want to have a conversation, they want to pick up the phone, they want to call, but they have to search for your phone number, it's a big turnoff. We want to make sure that the information is at people's fingertips. And that ties into the next item here, the patient portal. There's some amazing resources available. Patient portals make the experience so much better for the end patient. Let's make them understand that being a patient of your practice is simple. It's easy. When I have a question, I can reach out online. When I need records, I can find that. When I want to schedule an appointment, it's simple. It's seamless. I don't have to leave a message and wait for a call hours later or days later. Let's make it easy. We want to make sure that your hours are clear and upfront. We talked earlier about how many people feel like hours and location are extremely important. Let's make that information prevalent for people. If you have extremely convenient hours, let's highlight that right up front to entice people and make them know that being a patient or a family of your practice is easy and it's convenient. And we want to make sure that we have resources. All too often, I see healthcare practice websites are just brochures. We'll get into that in a second here. But let's provide good quality resources for patients, for parents, for caretakers, maybe even for referring practitioners. Let's make our website a destination. Next is messaging. We want to make sure that we have the right messaging on our site that appeals to our target audience. So we're selling into parents. We're selling into caregivers. We want to make them feel comfortable and make sure that they understand that we have their children's best interests at heart, that we make being a parent and scheduling these appointments easy and convenient. Over 70% of people want to know what insurances you accept. Let's make it easy for them to find that out. Let's promote that. And I rarely come across a healthcare practice that does an amazing job of this, but let's make that a piece of content. Let's build that into our messaging so that we allow people to find out what coverages are accepted. Let's add some personality behind your providers. Okay, credentials are great. People want to know that they went to a reputable medical school. Okay, that's terrific. We want to include that information. But what else? Are your providers parents themselves? Have they been in journals? Are they very well liked by their peers? Are there testimonials and reviews from existing patients about them? What do they like doing when they're not in the office? Let's give some behind the scenes about who they really are as a person. Let's make people feel comfortable. Let's do things like highlight their favorite children's book or their favorite story. Let's get to know the pediatricians and the providers so that new patients feel comfortable before they even step in the door. Let's also extend that to our office staff. Office staff can have a huge impact on patient loyalty and the overall patient experience. Let's make sure that before someone even walks in the door, they knew who the medical receptionist is that's going to greet them. Let's put a face to the name and let's build that comfort. Let's build that trust. I mentioned this earlier, but let's make appointment scheduling easier. Many practices have spent a lot of money on their EMR systems. They have great patient portals. Let's leverage those and make sure that that's easy and simple to use on our website. Again, let's highlight our hours and make sure that we have convenient hours and people understand that we're open when they need us to be open. And let's turn our website into a resource, not just a brochure. And what I mean by that is oftentimes there is an overview of your physicians, there's your hours, there's your location, and maybe a little bit about what your practice does. Okay, that's a brochure. It's not a resource. Parents and pediatric patients have questions. They have problems. They have issues. Let's turn your website into a resource for them where they can find answers. If we can provide answers to new or expecting parents, if we could provide resources to parents that are dealing with toddlers and different learning stages, if we can look at parents that are dealing with teens or early adolescents and dealing with a whole host of other issues, and we can provide and be a resource for them to find answers, to find advice, to find guidance, and we can provide that right on our website, you're immediately going to build trust, you're immediately going to build visibility, and you're going to drive a lot of traffic to your website. So I want to talk about that a little bit. On the screen right now is an example of a practice that we're working with that's using our Pediatric Resource Center. Okay, so this is an add-on to their website, and it's broken down by different age categories. You see here, there's expecting, there's newborn, toddlers, preschool, grade school, and finally teens. And within each one of these categories, there's amazing content that covers some of the biggest issues and concerns that come up at each age range. Okay, and we provide great insight for parents with the early age ranges. And then with the older age ranges, some of the content is geared towards the patient themselves and navigating growing up. But a lot of the content is also geared towards parents dealing with issues and concerns. So you can see a few examples here that I like. There's a mix of articles, there's infographics, there's just a whole host of 50 or 60 different great pieces of content. Now, when we're thinking about growing our pediatric practice, we need to get in front of people that are expecting. Okay? Great content like how big is my baby this week, or what do I need to pack when I go to deliver my baby, or how do you even choose a pediatrician? This is all great information that you should have on your website, but it's also great information that attracts people to your website. So when you're expecting, there's a lot of confusion out there. You're new to this in many cases. You want to make sure that you do your due diligence, you do your research, and who are you going to trust? You're going to trust the practice that has some great insight and great resources for you. And in the lower right corner, this is very timely. In many areas, schools are back in session. How do you address poor school performance? How do you nip this in the bud? As a parent, how do you support your children and help them overcome challenges at school? This is all great information. And pediatric practices can be a resource for this great information. Again, it's going to help attract people to your website, When somebody is doing a Google search and they're looking for answers to a specific question, we want them to find your practice, not the practice down the street. We want to build and earn that trust for your practice, not the practice down the street. This is a great way to do it. And this stuff works. This particular practice that I shared on the previous slide, they added this to their site, and within the first few months, they saw an 80% increase in page views on their site, just by turning their site into a resource. By turning it from an online brochure into a resource, 80% more page views. Time on site grew dramatically too. And there's studies that show that time on site and increased time on site is a good indicator that people are going to convert and potentially become patients. So if we can get them to your site at first by solving a specific problem or issue that they had, if we can keep them engaged on the site because we've provided great solutions, they're more likely to learn about your practice, learn about your providers, learn about your hours, your patient portal, and hopefully fill out a form to request more information about becoming a patient. And this is a great way to overall improve your website, drive more visibility, and increase your patient count. So let's transition now. Pediatric practice growth tip number 2, get more reviews. Some more data and stats for you. 94% of healthcare patients are going to use these online reviews to evaluate providers. And we talked earlier about how influential word of mouth from family and friends is. Well, online reviews can be just as important, maybe even more important. 84% of consumers trust reviews online as much as personal recommendations from friends and family. So when you're going out there and soliciting feedback, when you're soliciting reviews about who to choose for a doctor, what pediatricians are great in your area, people are going to ask their friends and family. They're also going to go online. They're going to do a Google search, like Lauren mentioned earlier. And what's going to pop up are practices and reviews. We want to make sure that we're visible there. Reviews drive visibility. They're going to build trust, and they're going to create new patients. In the screenshot we see here, this is a healthcare practice that we're working with right now, and we're helping them build more online reviews. We have a great survey that is sent out to patients after their visit. They can even fill it out in the lobby. They can scan a QR code and use this technology to leave feedback about their experience as a patient. And if you look here, within the last year, we created over 1,000 4- and 5-star reviews for this practice. This is all highlighted on their website. So now when somebody comes to their website, not only can they learn about the doctors, not only can they learn about the services and the practice itself, but they can get firsthand feedback from past patients that have gone out of their way to leave feedback. And they can feel comfort and trust knowing that other patients really enjoy the practice, that other patients appreciate the healthcare. It's an amazing way to build trust and visibility. And this one actually scared me a little bit. 81% of consumers are unsatisfied with their healthcare experience. 81%. It's unfortunate, but as I mentioned earlier, some of it really isn't even their healthcare experience. It really isn't the interaction with the provider. Sometimes people are upset about the appointment, about the waiting times, about the office staff. And you can see the example here. This is somebody that left no star review. And the feedback was, I would not recommend this place to my worst enemy. This is no reflection on Dr. So-and-so. He is wonderful. But the office staff is very rude. Okay, the doctor was great. The person really appreciated the healthcare advice and guidance that they got. But they gave this office 0 stars because of the office staff and a rude experience. Now, as a practice, wouldn't you like to know this information so that you could maybe provide more training? Maybe you could look at what happened that day. Maybe people were just having a rough day internally and there's no real big problem. But wouldn't you like to reach out to this patient and comfort them? Wouldn't you like to make sure that this review didn't end up on Google or Health Grades? We need to be very cognizant of what people are saying about our practice, given the importance of reviews, given the importance of word of mouth, and given the importance of one-to-one feedback. So as a practice, we need to stay on top of this. All too often, I'll work with a new healthcare practice and they have no idea what the reviews on the internet say about them. And people can leave reviews about your practice overall, and they can leave reviews about individual practitioners. As a practice administrator, we need to make sure that we know what's being said about us. But we need to go beyond that. We need a proactive plan in place to solicit those reviews. As you can imagine, when people have a bad experience, they're way more likely to go out and feel the need to leave a review online. If they have a really good experience, they're probably not going to go out of their way to leave an online review unless they have just an absolutely knock your socks off amazing experience. So what happens is your practice reviews get filled up with all those 1 and 2 stars of people that were, upset about the waiting time or upset that they couldn't get in to see the doctor for another week. Okay, if you're not careful, your reviews will be filled with those. You need a proactive plan in place to go out there and solicit reviews from your happy patients. There's no way to eliminate all bad reviews. We're in a people business. But what is impactful is having maybe 1 negative review and 30 positive reviews. That 1 negative review is still there, but the 30 drown that out. So get proactive about building these reviews. And then once you do build these, we want to repurpose these on social media. And I'm not going to go too deep into this because Lauren's going to cover this in a minute when we talk about how to use social media to grow your practice. Pediatric practice growth tip number 3 is investing in search engine optimization, or SEO. In layman's terms, this is when somebody Googles something when they're looking for a pediatric practice. Do you show up at the top of search results, or does your competitor? What's interesting is if you think about the amount of time people spend on Google searching, 5% of all of those searches are healthcare related. That's an astounding number. When you at the surface, if you think 5%, you're like, oh, that's not that much. But when you think about how often people are using and searching Google, and you think about 5% of that total volume is related to healthcare, people are out there looking for answers. And that gets back to driving the importance of great content and turning your website into a resource, not just a brochure. People are out there looking for answers to health-related issues. They're looking for answers to parenting issues. We want to make sure that they find your practice, not the practice down the street. The first organic search result in Google gets 28.5% of the clicks. Then you can see number 2 and number 3. If you want to drive more patients, you need to own search results. We need to make sure that when people are looking in the geographic market where your office is, that you're at the top of the list, or at least in the top 3, so that we can secure more of that traffic, drive more visibility over to your website. Once we get them to your site, we need to make sure that they stay there and they convert, and that's where that website experience and the content comes into play. But we need to make sure we get them there to begin with. Now, let's talk a little bit about how we optimize a pediatric practice website. First and foremost, we want to make sure that individual physicians and individual providers, your mid-levels, have their own pages. If somebody is going to refer a doctor, they're probably going to refer them by name. We want to make sure that your practice shows up when somebody is looking for physicians or providers by name. You can do that by creating individual pages for each one of those people, and making sure that those pages are optimized in the right places. We also want to look at creating individual office pages. If you have multiple locations, let's not just have one contact page that lists all those locations. Let's create individual pages for each location. By creating those individual pages, it gives us an opportunity to rank locally. And again, we saw the data earlier that people want to find an office that's close to them. So if you have offices that are 5 or 10 miles apart, let's create individual pages for each one of those offices so that people within those vicinities find you, and you can rank well when somebody's searching for a pediatrician in their city. Let's look at meta titles and meta descriptions. I'm not going to get too technical in today's webinar. We have a whole great series of content on search engine optimization, but we want to make sure that each page of your website has a great meta title and great meta description. This is what shows up in search results when you do show up in search. So if you're a pediatrician in Columbus, Ohio, for instance, let's make sure that our Columbus, Ohio page says top pediatricians in Columbus, Ohio. And then our description says something along the lines of XYZ practice is the leading pediatric practice in Columbus, Ohio. We offer convenient appointment times and great hours for families and patients in Columbus, Ohio. Okay, let's tie in local SEO. Let's tie in our value proposition, and let's make sure that people know that we provide convenient hours, and again, tie all of those items that we talked about in messaging right into our description and our titles. Let's make sure we localize our SEO, and a big part of that is creating those individual office pages and making sure that we have the specific city or town included in that. But then let's also claim our Google My Business listings, which is free to claim, but let's make sure we claim those so that we show up on Google Maps. Let's look at our user experience on our website. Let's make sure that our websites are secure, so they have the HTTPS in the address. If you don't have that S, that means your site isn't secure and information can be stolen from that. Let's make sure that it's secure and people feel comfortable. Also, let's spend some time looking at the mobile experience. Mobile's a biggie. Google is shifting now to more mobile search. So take a look at your practice website on your phone, on your mobile device. Make sure it provides a good experience. If it doesn't, you're probably not going to rank well in search. If it does, great. But let's make sure that all of those functions and features on your desktop site also work on mobile. We need to look at building more inbound links. This is a biggie for Google. If you earn more inbound links back to your website, this is a good indicator to Google that you're trustworthy and that they should rank you higher in search results. So think about referring partners. Think about other practices within your network. Can you have reciprocal links? Can you build more inbound links? Also, a great way to build inbound links is to create better content. Make your website a resource. Like we shared the example of the Pediatric Practice Resource Center. That is a great opportunity for you to answer questions, provide great resources, and it encourages other websites to link to you. And the box down at the bottom, I won't read all of this, but what's really important to note is that this comes directly from Google's Webmaster Blog. And they've come out and said that creating compelling and useful content will influence others more than any other factor. If you want to rank well, if you want to own search results, if you want to be at the top of the list for somebody that's searching for pediatricians in your city, you need to turn your website into a great content resource center. And again, this stuff works. Better search rank and a good website that converts will lead to new patients. And this is just a quick example. We are helping a pediatric practice, several of them, search engine optimize their website. And in a very short amount of time, we've seen page views go up by 50, 60, 70% in some cases. We've seen average time on site double. So there's great opportunity to not just rank well and show up in search results, but to earn those clicks, engage people more frequently, and get them to flow through a request an appointment page. And that's really our goal. All right, pediatric practice growth tip number 4, improve our social media presence. Social media is very, very influential. Again, I keep coming back to this stat. What sources of information do you trust most when you discover a new product or service? Your friends and your family. Okay, you're going to ask people. But I got another question for you. Where do friends and family interact? Okay, they're interacting here. They're interacting on social now more than ever, especially with the pandemic and COVID and all the other challenges we have right now. People are turning to social media as a way to stay connected. Lauren, I'm going to pass this over to you. You work so closely with many of our clients on their overall social strategy, their social media implementation. Walk us through how organizations, how practices can improve their social media.
Yeah, absolutely. So yeah, let's get into it. So this list is just a general overview of what we're looking at, just big picture tips we can look at. Knowing your audience is a big one. Understanding that the majority of your social media posts are going to be targeted towards parents and caregivers and ultimately people that are seeking the care of a pediatrician. Claiming your profiles and your social media accounts. So profiles, we're looking at things like Google My Business and accounts. This is, your Instagram, Facebook, Twitter. And this is a really important one right here, number 2. A lot of people have the misconception that marketing, especially social media marketing, has to be extremely expensive. And the long and the short of it is it's not. Creating accounts on websites like Google My Business and your Twitter and your Instagram doesn't cost anything. And whether you want to use money to promote those ads is a completely different story, but just getting that set up and you can do a great job for free. Having a social calendar is also extremely helpful for smaller practices that may not have a big dedicated social media team. Essentially just taking a few hours every month to go ahead and do your social calendar. And by that, we mean planning out your posts and your images and what you would like your captions to say, your links, that sort of thing. That really can help improve your efficiency and sort of take the burden of constantly keeping social media up to date off of one person. Posting consistently, is another thing that's really important for your brand visibility and your brand awareness. You don't necessarily want customers to have to come seek you out, but rather just know and trust that you're always there and you're present on that social media. Building transparency and trust is another thing that we've been talking about throughout this webinar, and we'll get into some ways to do that with some more specific examples of social posts here in a minute. Sharing great content, obviously you want to be sharing great content, and being timely is another way to help build that transparency and trust, which we will get into here. All right, so the first thing we're looking at here is introducing your providers and staff. And Brad has said it, and I will say it again. You know why you and your patients love your providers, and you have to let other people and your new patients know just why you love those providers and staff. So as we said before, showcasing their personalities and telling a little bit more about them beyond just where they went to medical school is a really great way to foster trust and inspire that sort of recognition and comfort that patients will really know ahead of time who they're going to see before they physically see them in person. And these are just a couple examples of some posts that have been done for one of our pediatric clients. This one down at the bottom here with one of their medical assistants actually did very, very well on social media. And it was really cool to see people commenting underneath the post just saying, oh, hey, we know her. We see her all the time. We love her. She's one of our favorites. So it really goes to show how something as simple as posting a picture and some information goes a long way towards improving your trust. All right, next, we're going to talk about helping to solve timely challenges. And Brad kind of touched on this, But parents, caregivers, babysitters, they always have questions and they are always seeking information. So really what you want to try to do is anticipate that ahead of time, because again, that goes a long way towards improving the trust that they have for you. A good example of this, thinking about how flu season is up and coming, and sharing content on how to stay healthy and how to get vaccinated at your pediatric clinic, for example. This example here is talking about back to school, which is also very timely. As Brad said, a lot of places are back in person in full swing. So this is just providing some resources for making friends and how to deal with bullying. All right, next up, we've got building a local connection. This one seems pretty self-explanatory on the surface, but it's really important to remember that, especially as a pediatrician and somebody who's providing care for the children and younger people of your community, you want to be seen as not just a business, but also a member of the community. And that goes a really long way towards authenticity and coming across as more than just obviously somebody who's interested in making money. So sharing local events and bits and pieces of community knowledge is a surefire way to build that relationship with your audience. Just an interesting side note about a project that I was recently working on for a client. I was doing some research and actually found out that the pediatrician who popularized the stethoscope actually went to a medical school right here in Buffalo. So it was interesting, and it was their birthday on a day coming up soon here in October. So it was interesting just to share that post and make that connection. Okay, next thing, we've got promoting your patient portal, appointment scheduling, record requests, etc. And this one is really about making things easy for your client. It's really about, as Brad said, improving the functionality both of your social media and your website. And it's also a really easy way to showcase that you are a resource for your patients. You're there when you need them. And like I said, you're sort of anticipating what they may need before they need it. And once they get to your website through following these links, it'll be a lot clearer what your end goal for them is once they're there, whether they're looking to schedule an appointment through the patient portal or requesting vaccination records.
And Lauren, just to jump in here, one thing that I've heard repeatedly from different pediatric practices is once school comes around, they're just inundated with physicals and sports physicals and everything else. Social can be a great way to remind your patients and your patient audience that they can schedule those physicals. They can schedule those throughout the year so that you're not inundated right when school hits. And social is a great way to make that easy and simple for people to request that appointment and encourage people to use more of the patient portal to do things like that.
Oh, yeah, absolutely. All right, next up, we've just got, this is a really simple one, announcing practice updates. And again, it might seem like this one is really straightforward, but it's very important just to make sure that you keep your clients updated, and that's another major factor in trust. So whether you update your hours, your staff, make sure that you keep your patients in the know. One of the things I recently did for one of our clients, they had a new pediatrician join their staff, so I helped them kind of put together a get to know you post for the new pediatrician. And again, it was really cool to see how welcoming and excited people and their client base was to see a new face in the office. All right, repurposing reviews. This one is a big one. Brad has said it a few times. People really trust the reviews of others, and seeing these testimonials and seeing these reviews is a great way for your clients to understand that they can trust you. And showcasing testimonials kind of allows you to take out two birds with one stone, in that your customers have sort of created the content for you. Their testimonial, they've done that for you. And then it's also extremely relevant to what both your clients and what your new clients and your potential clients, it's what they want to see. So really you're letting others do the work for you, but in a really, really productive way. So this one is a super great way to use social media. All right, and lastly, we have driving traffic back to your website. And this is actually one of the biggest mistakes that Brad and I see when we're working with our pediatric clients, is when pediatricians, they share third-party content on their social media feeds, their blogs, what have you. So right off the bat, that doesn't necessarily seem like it would be a bad thing, sharing an article that has external health information that you might have, that you might not have on your website. But if you think about it, this is a way to drive people off your website and potentially away from you and towards other competitors. There's a great resource called Healthy Kids, which again, right off the bat seems, of course, you would want to share information from them. But they actually do have a feature for a search portal for other pediatric offices in your vicinity. You type in your zip code and it brings up a list. So right there, you have the potential to drive customers away from you and towards your competitors. So sharing blog posts and relevant content like that off of our resource center, these posts here are from our resource center. They're a great way to promote really interesting, relevant, helpful content, and also get people to come back to your website where they will see the information about scheduling appointments, fulfilling what they need to do through the patient portal.
Yeah, and Lauren, just to build off that, and thank you so much. Just great tips, great insight. I love the practical examples here. But overall, social can help you deepen relationships with your existing patients and families and create new ones. Lauren just laid out some great examples of what to do day in and day out, but that last slide that she shared was a very important one. When you're sharing content, you want to make sure that you're sharing content from your website that drives traffic back to your practice website, not to an outside website where they can find a different practice. So if you create a website that has just a wealth of resources, a wealth of articles, infographics, great content, you share that on social, and then you close that loop and drive that traffic back to your practice. And this is an example of the impact that can have. This is a month after launching the patient resource center that we showed earlier and building a social content calendar and just sharing that content. There's a one-click share button on all those articles and all that content to feed it over to your practice's social media sites. Just by doing that over 1 month, they drove 78, almost 79% more users back to their website. It's getting in front of more existing patient families and building that bond, but getting in front of new patients as well. So very powerful stuff. The last tip that we want to share is tip number 5, using online advertising. Healthcare advertising spending is expected to increase 18% in 2021 and even more in 2022. And we're finding that digital ad spend is overtaking TV ad spend to be the leader for the first time ever. Practices are beginning to embrace digital, and for good reason. There's some great ways to use it to drive visibility in your local market. One of my favorites is to run geofenced ads. So again, at the beginning of this presentation, we highlighted some stats and we showed that 69% of people reported that location was extremely important when choosing a doctor. What are you doing to market in the general vicinity of your offices? Let's set a radius around your office and let's set some demographics and let's run ads to let people know that we're welcoming patients of all ages, that we're here, we're local. Let's set this up around each of your practice locations. That's where the majority of your new patients are going to come from, within a 5 or 10 mile radius of your office in most cases. Let's use geofenced ads to get your brand, your practice in front of people that are much more likely to use your services. Lauren mentioned that she used social media as a great way to promote a new provider that joined a practice. Let's also look at promoting new practitioners or providers using very targeted ads. In many cases, a new provider might come from another practice. And if they do, let's use these ads to make sure that their former patients know that they've moved on to a new practice. Let's buy their name as a keyword in Google, and let's drive that traffic back over to your practice so that they don't stay with the existing practice. Let's look at targeting people based on their social demographics or their interests. When we think about the precursors to needing or choosing a pediatrician, maybe it's somebody that recently moved into the location. Let's target new people, new homeowners in the market. It could be someone that's getting married. Okay, let's look at some of those triggers. Let's target people that are interested in weddings or wedding planners or other things like that. Let's begin to show ads for them on Facebook and other social platforms that highlight your office. Let's look at people that are expecting, that are pregnant, that have shown based on their search behavior or their social media follows and their behavior that they're potentially pregnant. Let's show ads for your practice. Let's share great resources from your resource center that build visibility for your practice. It's a great way to drive traffic from people that need your doctors and need your practice. Now, does this stuff actually work? We've talked a lot today about different things that you could be doing, but does it actually work? And Lauren, I'm going to put you on the spot again. You work with a lot of our clients. What's your gut tell you? Does this stuff actually work?
In short, yes. And if you don't believe me, we've got stats here that Brad's about to show on the next page that just really speak to how well that this type of marketing can really work.
Yeah, it really does. So what we shared today wasn't just theory. We're using this in practice. We're doing this for several practices, several healthcare organizations, and it's driving great results. We're increasing practice visibility. So looking at combining the resource center with some paid ads, with some social engagement, adding in the SEO value of content to your site. This particular practice saw a 79% increase in users to their website. Page views are up over 80%. Not only are we getting more people to their site, they're viewing more pages and converting at a higher rate. We're seeing increased visibility of pediatricians, and this is a biggie. We want to make sure that people are comfortable with your providers. We want to get them over to your site. We want to attract them with resources, but we want to get them on to the next step to learn more about the provider. And this practice saw a 56% increase in page views to their pediatrician pages. But more importantly, our patient and appointment requests. By implementing a lot of the strategies that we've talked about, new patient requests went up 58%. And then overall appointment requests were up 71%. We're getting more people to use the patient portal because we're attracting them with great resources, and then we're highlighting and have strong calls to action that show that working with their practice is easier. And just overall, online visibility skyrockets. You can see some stats here. Organic search results were up almost 100%. We're getting more direct traffic. We're getting more social media traffic. It is an amazing way to drive visibility in the local market for your practice. Now what? You might be thinking to yourself, well, geez, what do I do now? There's a lot of information here. I don't have a full-time marketing person. I don't know what to do. We're here to help. And this isn't a sales pitch, but really we want to be a resource for you. I think the easiest thing that you could look to do is turn your website into a great center of influence. Add the Pediatric Resource Center to your site. The example that we shared is available to be branded and added to your website. There's over 50 great resources, and we're adding new content each month. There's one-click social media sharing. So if you're thinking to yourself, how do I create a social media calendar? Well, it's simple. Go in and click a button, and we share all that content over to your socials. New content's added. We have strong calls to action to increase patient portal usage, to drive more appointment requests. And again, everything is branded to your practice and your website. We're going to keep people on your website instead of taking them to an outside resource where they could find other practices. And for those listening to the webinar today and that have registered, we're going to waive our setup fee of $595. And we offer this for a low fee of $195 per month. It's a great opportunity to turn your site into a great resource and really simplify your social media strategy. We also offer website development We do social media management if you want to get more in depth. We offer search engine optimization to improve your visibility and make sure that you're at the top of search results. We have some amazing online advertising packages that focus on geofencing, promoting specific offices or practices or practitioners, some great opportunities there. We'll do general practice brochures and collateral, review management and reputation management to build more online reviews. We can certainly help with that, and overall offer consulting and support. So if you're ready to grow your practice, reach out to us today. Learn more at barqar.com. It's BARQAR.com. Or give us a buzz at 888-576-6100. Thank you all so much. Lauren, thank you so much for the great insight today. I'd like to open it up for questions right now. We've got some great attendance on the webinar. Hopefully we answered a lot of your questions, but I would like to encourage you to use the question and answer panel in the right-hand side there and ask any questions that you have. We're happy to help answer those and stay on the line here. So I'll give you just a moment to type those in. One common question that kept coming up throughout the webinar today is, are you going to make the slides available for today's webinar? And yes, we'll certainly make those available. You can visit barqar.com, call us at 888-576-6100, and let us know that you want those slides, and we can email those over to you. We're also going to make a recording of this webinar available for people that want to go back and revisit that. So if you do want that, just reach out to us and we'll get a copy of those over to you. A few more questions came in. Number one, this is a good one. How do you get more patient reviews? So I showed that example earlier, and I'll go back and see if I can find that slide here. How do you get more patient reviews and get more patients to actively go about promoting and leaving a review? It's a big one. And the answer is you have to be proactive about it. As I mentioned earlier, people are likely to leave a review if they did not have a good experience. Okay. Those aren't the reviews we want to solicit. We want to solicit the good ones. So what do? You need to proactively go out there and survey people. So in this example, this is the practice that we've helped collect over 1,000 reviews for that display on their website and online. And what we do is just have a survey that is a simple survey, and it's only 2 questions. It's how would you rate us? And then can you leave a little bit information about your experience? Really simple. People can complete this in the lobby if they want, or they send this out post-appointment, and they send it out via email. So really simple, really easy to do. Leave some instant feedback. Helps them collect great content that they can build more positive reviews and build their ratings with, but also, as Lauren mentioned, leverage in social media. So they'll take these great stories, and you don't want to name the patient, you don't want to use patient names, but you take these great stories and highlight that in your social to build comfort and build trust. All right, another question came in. How do we add the resource center to our website? Is it just a link? Very good question. So with the Patient Resource Center, we are waiving our setup fee. So that setup fee of $595 is waived if you're attending and listening to this webinar. And we then do all the hard work. So it's not just a link. So what we don't want to do is just link out to a resource and take people away from your website. We actually want this content embedded and branded right within your existing website so that people aren't taken somewhere else. All of this amazing, great content resides right on your website. So we embed this right on your website. We'll work with you to add this to your site. Very easy process for us, and we brand everything so that there's no disconnect. It's embedded and branded right into your website. To get that started, all you do is reach out to us, and we can talk about options. We can show you some samples and talk through the process. But all in all, we can turn your website from brochure into an amazing resource center within like a week or two. So it's a really simple process. Uh, this is a good question that just came in, and we get this a lot. With the practices that you deal with, do most have an internal marketing person? Lauren, since you're dealing with a lot of our practices, I want to start with you. The practices that you're dealing with, do they have somebody internally that focuses only on marketing, or are you working with somebody else usually?
Um, Actually, believe it or not, most of these places do not have a specific marketing person, and that's a lot of the time why they are coming to us for help, because they sort of know that they need to do a little bit more. They're interested in doing a little bit more, and they're just not entirely sure how to get started.
Yeah, I would echo that. We find most times that marketing unfortunately falls on the office manager, the CEO, uh, the medical receptionist, the administrative assistant. Sometimes it falls on the person that is the youngest at the front desk because they just quote unquote get social media. And unfortunately, it falls by the wayside and doesn't get done because those people have so many other responsibilities between medical billing, scheduling, patient follow up, everything. There's so much that people have to do that marketing just falls by the wayside. And unfortunately, that hurts the practice overall. So, what we try to do is make it as simple and seamless as possible to work with us. So, if you were to work with us, you'll work with someone like Lauren that understands the challenges that your practice is going through, that will try to make things as simple and seamless as possible for you so you can have great marketing, great digital marketing, drive great results, but it doesn't have to take up a lot of your time or the time of your providers or leadership. Another question came up. When you're talking about SEO, you mentioned the importance of Google My Business. What is that? So Google My Business is and if you go to Google and just type in My Business, it's an opportunity for you to claim a location page. So let's say you have multiple offices. Each individual office could have its own location page. And that's really important if you want to show up on the map when somebody is doing a local search. So you want to make sure to go and claim your Google My Business page for each one of your office locations and make sure that you add photos, make sure you add your logo. You can add practitioner images. You can add and upload images of what the inside of your office looks like and what patients can expect when they walk in the door. It's vital that you do this if you want to show up in local search. And this is something that you need help with. We provide these services as well as a lot more search engine optimization services to help. So reach out to us and we're happy to help. Let's see. And then I think there were a few versions of this question throughout. So I'll try to summarize here. How much do practices, what is the average amount that practices spend on marketing? This is kind of a tough question to answer because the answer is it varies. And it varies because of physical location. So if you're in a metro, very competitive market, large city, your spend's going to have to be more to drive that visibility than it would be in maybe a rural setting. So it really is going to depend. But if you look at overall marketing spend in general, so the Small Business Association says that small businesses with gross revenue maybe of like 10 million or less should spend 7 to 8% of gross revenue on marketing. Now, that also varies by industry. So if you're looking at like consumer goods or tech, that's probably in the 20 to 30% range, and it goes down from there. If you look at healthcare and pharmacy marketing budgets, the average is right around 9 to 10% of gross revenue is invested back into marketing and practice growth. So that's, I think, a good percentage to strive to. I will tell you, though, that the majority of clients that we're working with are spending probably half that or less on marketing. Many of them don't have marketing budgets that reach that 10% of gross revenue mark. And I think that you can still do a lot if you're strategic in your spend and you do the right things. So that actually covers all of our questions. If I didn't get to a question that someone asked, please reach out to us. Give us a call. Visit barqar.com. That's BARQAR.com. I'll pull up our contact information here so that you have that. We'd love the chance to talk with you. We can talk about overall what we can do to grow your practice, what we can do to create a strategy for you, and what we can do to really simplify marketing to make sure that it doesn't fall on one person's shoulders in your practice and fall by the wayside. So again, give us a buzz, 888-576-6100. Thank you so much for attending, and reach out if you would like a copy of slides or a recording of this presentation. Take care.